Good morning. It's great to hear all that conversation. You'll have plenty of time for that over the next 2 days, and we know that every bit of it is valuable and will make you more effective. Well, maybe not every bit of it, but most of it will. What an amazing event. What a great opportunity to have you all here. You will be hearing a lot more from those of us from the Office of the National Coordinator. My name is David Blumenthal. I'm the National Coordinator for Health Information Technology. And my staff and I will be mixing with you throughout these next couple of days. We're so grateful for you being here and for the work you're doing. But before we launch the hard work of the event, I want to take the opportunity to introduce to you the person who has been an enormous support, an enormous leader, a terrific leader for this work and so much else that the Department of Health and Human Services and the federal government has been doing in healthcare. Not since we launched as a country the Medicare and Medicaid programs in 1966 have we confronted the kind of challenge as a government and as a health system as we do at this moment, as we try to fulfill the vision of the Affordable Care Act. And we are truly fortunate to have Secretary Kathleen Sebelius at the helm during this time. She is the perfect leader for this moment. Wise, steady, great judgment, great political instincts, and a true commitment to the welfare of all Americans. She sees the sweep of programs in the department, sees how they fit together, and gives them each the support that they need, including our own programs in the area of health information technology. So it's a great pleasure for me to introduce Secretary Kathleen Sebelius.
Well, good morning, everybody. It's wonderful to see this big crowd here for a couple of days of important work and conversation, and I want to not only welcome you, but also thank you for the work that you are about to do to help transform the healthcare system. I really want to start, though, by thanking Dr. David Blumenthal, our Health Information Technology Coordinator. He came into this role not as a techie, but as a practicing physician, and one who has used a health information record, an electronic record, to treat his patients. And I think that gives him the perfect perspective to lead this initiative. You know, I have worked on health technology for a long time. As a governor, we tried to put together a platform in our state and worked with a lot of providers and insurers to bring information together. But the missing piece was always having a real federal partner, having a national platform, having the ability to convince providers that if indeed they made the conversion from paper files to electronic health records, that they would have some interoperability at the end of the day, that they'd really be able to communicate with other systems. And that barrier, I think, became a bit insurmountable for lots of providers across the country because there was just such uncertainty. And we are at a very different point in the country today, and I think you all are here on the forefront of what can be a new information revolution. I also want to acknowledge our department's Office for Civil Rights and the Centers for Medicare and Medicaid Services for making sure that we continue to focus on privacy protection and improving care. And I know you're going to hear from another of HHS's great leaders, Dr. Don Berwick, after a bit. You know, this year's meeting, for the first time, brings together the awardees of the technology grant programs that have been awarded both under the HITECH Act and the Recovery Act. You are on the front lines, moving health IT forward, and you're the ones training the IT staff that will be running these systems. running the Beacon communities across the country who will serve as models and let us look at the very best of the best, the sort of pace-setter programs. The administration really wants to do everything we can to support your work, to accelerate your work, and to make sure that together, sharing best ideas and best practices, we can have great success. So part of what's going to go on in the next couple of days is to look at creative new strategies to increase health IT uptake, to strengthen the national and local and regional partnerships, to promote meaningful use, and ultimately, the goal is to improve the quality of care and the health of all Americans. We do have a fantastic number of people here, a wonderful participation at this first ever meeting, and nearly every grantee is represented. The Beacon Community Programs are here in force. Regional extension centers are represented. The SHARP programs, state health information exchanges, and many of you who are going to be doing the workforce development work. So the course of the next 2 days is going to cover a wide range of the topics that you'll be dealing with, from privacy to security to how to drill health IT into our most rural and remote areas in America. And this couldn't come at a better time because, as you know, starting in 2011, we start a whole new chapter in health information technology. When the Affordable Care Act was signed into law last March, the vision to vastly improve the national health system was really set on an important platform. And the goal of the law was making the health insurance system better for all Americans, but also to make the delivery of health care better for all Americans. And we've already made some exciting progress. The Patient's Bill of Rights that's now in place ended some of the worst insurance industry abuses. Regulations are now beginning to frame large insurance premium hikes, and new state-based insurance exchanges are beginning to be set up in places around the country. High-risk pools already exist, and lots of corporations have joined the effort to make sure their early retiree programs can stay in place. But beyond the work done at the preliminary stages on the insurance market, there's some very important work to be done on moving America toward a 21st century health delivery system. Health care delivered at the right time, to the right patient, and the right care, which doesn't happen every day in America. And we knew we could not do that work, the delivery system changes, without a robust system of health information technology. Health records are the platform for a high-performing healthcare system, and we see it now in places around the country. There is no high-quality, lower-cost health system which doesn't use an integrated health record. If we want to improve the quality of care in America, we know this has to be the national platform. If we want to promote better coordination among doctors, we need to be able to move quickly and securely the health information of one patient from provider to provider and share it on a real-time basis. If we want to empower consumers to make better choices, they have to have more information about their own health systems without calling various providers' offices and trying to track down their own health history. And that's why the work that you are doing may be some of the most significant work in transforming the health system. Now, every year over the last couple of decades, we've seen industry after industry transform using information and using technology to bring down costs and improve customers' experience, to improve productivity. But healthcare is one of the key industries in this country where that still hasn't occurred. Just imagine for a moment going back to the days where you went into a grocery store and people were still handwriting price tags on products and shifting them manually, or you had to wait until a bank opened in order to get cash, or every bill you paid, you had to write a check and pay it. That's almost unimaginable in this day and age, and yet we still have a paper file system in some of our most important information. Now, earlier this year, I had the chance to visit one of the Beacon communities in Cincinnati. I went into Children's Hospital in Cincinnati, which does some of the most complicated prenatal and neonatal surgeries in the country, maybe in the world. They're very well known for this early surgery. They had gone 1,000 days without any kind of serious health incident in their NICU, where people are coming and going on a regular basis, and they have very, very sick babies. And they credit that safety record in large part to the integrated health system that they use and the ability to check protocol of every person who enters every room at every time. And it has been an incredibly important piece of the puzzle of not only delivering high quality care, but making sure that they don't have incidents along the way. I spent a lot of time across the country talking to healthcare professionals, and I have to tell you, I haven't met a single provider who uses a high quality health record who says, boy, I just wish I could go back to the days where I could write down all that information on paper files, and I really miss it. I miss those good old days. Everybody tells me they are a better healthcare provider because of the records they use. And what we see in hospitals and physician practices across the country is that when electronic health records are well designed, when they're implemented correctly, they can be a powerful force for not only reducing errors and lowering costs, but increasing both physician and patient satisfaction. We know how successful the systems are because many of you are seeing that each and every day. Now, I know I'm preaching to the choir. You all are already converted. But only a short time ago, the leaps and bounds that we've made so far were not at all a sure thing. When this administration came into office in 2009, we had a snapshot in the country where just 2 in 10 doctors and 1 in 10 hospitals, so 20% of doctors and 10% of hospitals even had any kind of basic electronic health record. That's pretty stunning. That meant, patients spent way too much time filling out forms, that infamous clipboard handed to you in every provider office, which reintroduces you over and over and over again to a healthcare provider. Doctors spent way too much time trying to hand record patient history, tracking down x-rays, and too often repeating expensive tests. My dad is 90 years old. It terrifies me that he is somewhat responsible for his own medication list, that he is supposed to remember from time to time what exactly it is that he's taking. And in fact, his health care may rely on that kind of patient memory information, which is not a very reliable source at this time. But we know also that there are some daunting obstacles to have take-up across the country of this new technology. It takes time to learn the technology, especially if you're in a small practice or a remote hospital without the time and resources to have a robust IT staff. It takes the challenge. Providers are still leery of whether that information is going to be secure, whether or not they're going to be able to share it with different systems. It's great to have a system in place, but if it's not interoperable, it doesn't give you much confidence or much real-time use. And we know that just the conversion itself can be expensive. Even if it pays off in the long run, there's some upfront capital costs. So healthcare providers may agree that there are some benefits, but there are barriers of difficulty and expense that have prevented a large take-up in the past. And that's why, as a key part of the Recovery Act, there was a significant investment made by Congress and the President to eliminate many of those barriers to health information technology. we're now busily at work through the leadership and of David Blumenthal and his wonderful staff of creating health IT extension centers across the country. And they're really modeled on the old ag extension centers where real live human beings came out to a farm, kicked the dirt around, looked at crops, and tried to decide what exactly was going on, why a certain seed wasn't growing as well as another, and gave advice to those farmers, which turned out to be enormously helpful. Well, the Health IT regional extension centers are the same kind of idea, real boots on the ground, particularly aimed at small physician practices and rural hospitals that need actual help in assessing what kind of system would work best for them and making that conversion. We're providing grants to states across the country to create a state-based framework for hospitals and healthcare professionals to exchange information and make sure that those systems are interoperable. Investing in our health IT workforce so providers will have the staff to hire when they need to make the conversion from paper files to digital records. And the centerpiece of the program really kicks off in January, when eligible healthcare providers and hospitals will be able to receive incentive payments for adopting electronic health records, as long as they are also on a pathway to meaningfully use those records to improve the quality of patient care. We don't want just the dumping of information from paper files to electronic files, but really to improve provider protocol at every step along the way. So together, those investments knock down a lot of the obstacles standing in the way of building a 21st century healthcare system, using technology to improve results and lower costs, just like every other industry in America. And at the same time, you, the grantees, are working to improve electronic health records beyond just a patient chart, but making sure that they become a tool to impact our health, our government, and our economy. We've got research going on to support innovative new strategies to improve the overall quality of healthcare by using the electronic health record data to generate the new best practices in medicine while maintaining the privacy and security of protected health information. Others are using funds or improving non-degree health IT programs that can be completed in 6 months or less. And those courses are going to help train over 10,000 new health IT professionals annually by 2012. And that's an important new workforce to have across the country. So thanks to the hard work that all of you do every day, we can see these investments continue to pay off. Since we've begun taking these early steps, we know that there is a new national momentum behind electronic health records. Across the country, doctors, hospitals, health IT professionals are realizing that health IT can revolutionize the way healthcare is provided for patients in America. So the goal has never been technology for the sake of technology. We're promoting health information technology, electronic health records, so they can be used to deliver better health care, to give consumers more control over their own health care, and at the same time making sure that that consumer information is protected. So we've worked incredibly closely with providers at every step along the way, with stakeholders, including doctors and nurses and hospitals, to make sure that we're going about the health IT efforts in a manner that makes sense for the people who will use and benefit from the products. Now, in the past, a lot of providers have been skeptical, but the meaningful use guidelines were drafted and put out for comment. We got over 2,000 comments from across the country and used that information to really improve and finalize the regulation. We carefully considered the input, and thanks to those comments, the rule we released puts us in a position to move the entire system forward while giving health professionals and hospitals flexibility to really take their own pathway to decide what kind of timetable works best for themselves. And when we released the rule, we had major insurance companies, provider groups, healthcare professionals, hospitals, and patients coming together to say they want to be part of this new future. So going forward, we need to keep this momentum going. I want to, again, thank you for the good work that you've already done to work on this system. Transforming the healthcare system is no small task, but I think there's no question that health information technology builds an important platform for not only measuring higher quality, lower cost care, but also helping providers to deliver the right care at the right time to the right patient. When these records are widely adopted, providers will have more information and more time to focus on their patients. Patients will have more control over their own health decisions. Employers can look forward to a healthier, more productive workforce and a stronger bottom line. And there are going to be more jobs across America in one of the key industries for the future, the technology of health information. So thanks to your creativity, your drive, your hard work, we're making progress, and we look forward to your partnership as we continue to move ahead. Thanks very much, and have a great conference.